in your group?
I'll read the question.
Okay.
What do you think the first day home with the baby will be like, and how could you make it positive?
Okay, we decided that it would be terrifying and tiring, and the best thing to do would be to have someone with you, whether your husband stayed home or your mother or mother-in-law.
Public health departments also sponsor education programs such as this to permit men and women to explore their feelings and fears about pregnancy. It's a painless way to discover you're not alone.
The hospital experience should not be thought of as an ordeal. You won't be there long. And chances are your going there is merely a precaution against unforeseen risks. Hospitals aren't perfect, but they're getting better, and it's the best possible compromise. Stay tuned for our next checklist.
The checklist for Program 4. Come to an agreement with your doctor about what you want and what you can expect. Choose an appropriate hospital. Visit the hospital early in your pregnancy. Pack a bag well in advance of your due date and include the following: 2 nightgowns that open in the front for breastfeeding, robe and slippers, 2 nursing bras, radio or cassette player for relaxation, clock or watch for timing contractions, camera if you have permission, heavy socks for cold feet in the delivery room, baby clothes, birth announcement cards. Inquire about rooming in. Can you have your baby with you in your room? Visiting hours. Are there special rules for husbands, family, or friends? Sibling visitation. What access do very young children have and when? Length of stay. Will you and your baby be able to go home when you want? In program number 5, we arrive at the culmination of 9 months of effort, giving birth to your baby.
What is that? That's a baby. That's not a baby. That's not a baby.
The stars of this episode are Janice and Michael Bells, who are about to have their first baby. Michael is a theology student, and he met Janice 7 years ago at a social function. Michael is 29, Janice is 30. Our cast also includes Linda and Howard Myler, who will show you how to ease pain and discomfort before and during labor and during the delivery. As we go, we'll describe the stages of labor and what you should do as you experience them. Within 3 weeks of delivery day, you may experience mild irregular contractions called Braxton Hicks contractions, followed by false labor. They are intense contractions, and with a little physical activity, they'll disappear. During this stage, the baby's head will drop into the pelvis. That's called lightening, and you will discharge heavy mucus, sometimes streaked with a little blood. Linda and Howard demonstrate how to ease the pain of contractions. When you feel them, stop what you're doing and concentrate on your breathing. You can apply pressure to the lower back like this. Your partner can help you. Using one hand only, stroke the lower half of the abdomen with a semicircular movement. Remember to keep breathing, in through the nose and out through the mouth. Your partner can also press hard on the lower back while you cradle your abdomen. Applied pressure on the lower back works wonders. Massaging the thighs will help reduce the pain of contractions, particularly with the onset of true labor. In the early stage of true labor, your contractions will become more intense with any change in activity. The contractions are usually from 5 to 20 minutes apart, and they will last anywhere from 30 seconds to a minute. This stage could last up to 8 hours with your first baby. You may find traces of blood. When the contractions are about 10 to 15 minutes apart, call your doctor. And if at any time the amniotic sac breaks, releasing the water surrounding the baby, you should definitely inform your doctor. It frequently happens at home, but you should leave for the hospital right away.
Well, when I woke up a little earlier this morning, I felt something was happening, so I got up and sure enough, there was a show of blood this morning, and then and I had a little extra energy than I do most mornings at 8 o'clock. So I thought maybe that was a sign too that today was going to be the day. And about 9 o'clock I started having mild contractions, but I kept doing things and felt quite energetic. And I just kept doing things until, I guess it was after 11, around 11, they started to go rapidly, being close together, in 5 minutes or less apart. And but not too strong at that point, nothing I can cope with. In fact, that's what kept me putting off coming. I should have known better. And it came.
Janice is in the active first stage of labor, and her cervix has dilated to about 5 centimeters. Her contractions are 3 minutes apart, and each lasts about a minute. She's already been given a partial shave and an enema, and she's getting nourishment from an intravenous glucose drip. Throughout this stage, she'll be encouraged to urinate as frequently as possible. Janice labors in the most common position, her body propped up at a 45-degree angle and her legs apart. It's 2 o'clock, 6 hours after she first knew she was in true labor.
Try and slow your breathing down a little bit.
Here's how you should breathe during this stage of labor. Take shallow breaths. In through the nose, keeping the lips slightly apart. Exhale through the mouth. Breathe rhythmically and gently, and work with the contraction. In and out, in and out.
Not too deep.
3 p.m. Janice's contractions are more painful now.
It's going.
They are longer, and they're closer together.
Relax.
Dr. Alexander Golab has examined Janice and determined that she is 8 centimeters dilated. Her blood pressure is normal. The doctor hooks up the fetal heart monitor. Normally, the baby's heartbeat rises during a contraction, but if the doctor notices that it stays down, it's a warning that the baby is in some distress. The doctor attaches the fetal monitor's electrode to the baby's scalp.
And that's what it's...
This little doodad here.
Now's the time for Janice to ask for an anesthetic, if she wants one, but she doesn't. This is how to breathe during this stage of labor. Go with the rhythm of the contraction, using the same breathing technique we illustrated previously, but this time make each breath progressively quicker and more shallow as you reach the peak of the contraction. As the contraction subsides, slow down and breathe more deeply. Remember to take a cleansing breath after each contraction, in through the nose, out through the mouth.
The average heartbeat would be, so this is what we call the baseline. Okay, the baseline falls in a certain way.
4 p.m. Janice is now in the transition stage. It is the most painful, yet the shortest stage of labor, usually lasting from 1/2 to 1 hour. Janice's cervix is almost fully dilated, about 10 centimeters in width. She feels the urge to push, but the doctor says it is not safe until she is completely dilated. During this stage of labor, count 2 very shallow but controlled breaths, then blow out quickly twice. Think of panting.
Good.
That's it. Pushing.
5 p.m. Janice is now in the second stage of labor. This is the bearing down stage, and her contractions are very strong. It's hard to tell where one begins and one ends.
Just relax.
This is where the fetal heart monitor helps Janice. By watching the increase in her baby's heart rate, she can anticipate when each contraction begins.
Okay. Keep going from breath.
She takes a cleansing breath, then bears down with the contraction. Her husband, Michael, is an invaluable support. This second stage of labor usually lasts between 1 and 3 hours with the first baby.
Oh, great. Oh. Relax your muscles.
A wet face cloth or ice chips can help.
Doing great.
Most women feel nauseous. It's quite common.
Let's use the contraction as much as we can.
Really push. Really push good. Push.
Keep it coming.
Push. Hold it as long as you can.
Oh, that's just beautiful.
As long as you can.
That's great.
Let's go and really hard again.
That's it. Push. 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 Push.
Real hard, long pushing.
Hold this one as long as you can.
That's wonderful. That's nice big one. That's good. Keep pushing. Big squeeze.
Oh, great. Great.
Good girl.
Good bad.
One more big one.
Oh, you're doing so
That's really so slow.
nice and slow. Nice and slow.
Swing down a little lower. You can feel it. Yeah, good. See, it doesn't want to go back anymore.
You're doing great.
See it, Janice? You can really feel it. That's the next contraction you get. You won't have to, you can push hard, but it'll come down a lot further this time. So you'll feel the stretching more. Okay? I can still see it. It's sitting here.
Let's review the different levels of breathing, this time using a feather to demonstrate. When the contractions are 30 to 60 seconds long, the feather is barely ruffled. Linda breathes gently with long breaths. When the contractions are 1 to 2 minutes long, use stronger, shorter breaths. Your breath returns naturally. When it feels as if the contraction is endless, your breaths should be stronger and shorter. The pattern is 2 panting breaths followed by 2 blowing breaths.
Melvin Clark?
5:45 p.m., the delivery room. The stirrups you see are there to support Janice's legs. The yellow antiseptic surrounding the vagina guards against infection.
Just breathe. Oh, push that.
That's the baby's head again. As you can see, the skin of the vagina is stretching to accommodate the baby's head. At this point, Dr. Golub could perform an episiotomy, making a vertical cut between the vagina and the rectum. But he decides it isn't necessary.
Keep your eyes open, Janice.
Uncomfortable one.
Don't push that down.
Don't push.
That's the girl.
Just a little bit more. It's the mini one. That's the mini one.
Well, what's up with this forehead?
Little one. A little bit more.
Do you feel that? Look at the little wrinkle on the baby's brow.
Give it a slight push. Through the one.
I'm so sorry.
Through the one. Good. There's your thighs coming right now.
The doctor is now checking to make sure the umbilical cord is not wrapped around their baby's neck.
Okay?
Now he clears the mucus from the baby's nose and lungs using a suction tube.
Okay, forward here, nothing. Just a slight push. Just a slight push.
That's a good push. You see, no, right? You
Now
know,
get the baby upwards. Keep going.
It's a girl.
You hold her under there. Yeah, look at that.
And I'll just suck it there, we are.
Now the doctor clamps the umbilical cord and cuts the lifeline that for 9 months has nurtured Janice's daughter, Nadine.
Well, we're going to put the baby in the warmer so it gets dried off and cool. It's a heavy one, eh? Yeah, it's big. You like to look at the baby? There you go. Oh, man.
Here. You wrap it up and let your mommy hold it. Just put it on your tummy there. Oh, dear. There, you talk to her. See? She knows. Baby up on the she's so nice and pink now.
Now, there in a few moments, I want to take the placenta out to make you a little bit uncomfortable, okay?
You got your mama?
6:30 p.m., the third stage of labor, when the placenta or afterbirth is delivered. It may take up to 30 minutes for this stage to be concluded. It may also be painful, so you must remember your breathing. It's now 11 hours since Janice first went into labor.
Just reach over and play with her. I think you're sort of red.
I think you're right.
1783, 1806. Baby girl Belle. Okay?
Nadine is getting an APGAR rating 1 minute after she's born. She'll be examined again 5 minutes after her birth. The doctor makes a standard 5-point checkup. Her heartbeat, respiration, muscles, reflexes, and color. He also looks at her spine, rectum,
Yes, she ever.
abdomen,
Everything's okay there. This is what they sometimes
Hips.
put for the legs in this area.
feet, toes, and fingers. This is a common indicator of how any baby will survive its human journey.
You were very helpful. Thank you. I'm sure you did a super job, Mother. Okay? Great. Rita, you're fantastic.
Much of the pain of childbirth can be avoided through the use of anesthetics. These include a conduction anesthetic, which provides complete pain relief while the mother remains awake. Local anesthetics, which are injected into the skin in and around the vagina. These provide immediate but short-term relief until the baby is delivered. A mixture of nitrous oxide and oxygen, which the mother inhales through a mask. The general anesthetic, used only in emergencies. Remember, all drugs that affect the mother affect the baby. Used anesthetic, with no long-lasting effect on either the baby or the mother. The epidural is a great advantage to women who experience long and painful labors. Here, the anesthetist applies a local anesthetic to desensitize.
Can it go any faster than this?
What? Watch it go.
Put it back in. Put it back.
Dude, she should at least like take it.
Yeah, like shave that thing.
Oh, there it goes.
Come on, Noah, keep on.
For some reason, it's funnier backwards.
Oh, that's still gross.
Oh, this is gonna be bad. It's like a truck going back in.
Shove it back in there.
Alright.
Put it back in. There you go.
Just put it back in. It was
It was ugly. It was ugly. Back in. Back in. It was ugly. No.
Suck. Don't push. Suck.
My stomach hurts from laughing this hard.
Oh, good. Alright, we're done.
Has you and Barf been watching this?
I almost did.
I thought, I guess.